Dr. Pat with Little Critters, and we have Dakota with us today. She's a 5-year-old husky, and Dakota presented today because she goes to doggy daycare and she's presenting for sneezing and nasal discharge. And that's not the primary point of this video. The main point is that it's very important to get regular exams for your dogs. At an exam, we're not just going to examine the region of the problem. We're going to do a thorough physical exam and look at the whole dog, just like your doctor would do with you. And what we noticed with Dakota when we were palpating her is when we palpated the mammary chain down here, she actually has some small bumps. They're only about 1/4 centimeter. They feel almost like little BBs under the skin. But the problem with them is they're in the mammary chain. And this is usually how we see mammary tumors or breast cancer start. Our concern with Dakota is that these small lumps in the mammary chain are the start of early breast cancer. And this can be benign, but it can also be malignant, meaning it can spread elsewhere. They can go to the regional lymph nodes, the liver, the kidneys, and it can be a very aggressive cancer in some dogs. These mammary tumors are responsive to estrogen. Mammary tumors in dogs are estrogen responsive, and what that means is that as they have heat cycles over their lifespan, they're releasing estrogen into the tissue, and that estrogen in the tissue is feeding the development of cancer. And Dakota is 5-year-old and an intact female. So she's had many heat cycles to release estrogen into the tissue in the mammary gland, potentially feeding these tumors. So the plan is to do a needle aspirate and send that out to the lab and find out what type of tumor we're dealing with, if it is indeed a tumor. And if it is, we would recommend spaying her and removing that mammary gland. The issue again is really that she's an intact female and has been so for a while. And this really reinforces the importance of spaying your dogs. If you don't intend to breed your dogs, they absolutely should be spayed. There are many studies on the risk of mammary cancer development and spaying at various stages of life. Dogs that are spayed before their first heat cycle have a very low risk. It's about less than 0.5%. After the first heat cycle, it goes up to about 8%. And then by the second heat cycle, we're at about a 25%. It increases with each heat cycle, so the risk in an older dog that's still intact is very, and again, some of these can be very aggressive and can spread. And we're lucky with Dakota because these are still really tiny. They're not really noticeable. The owners didn't even know they were there. But I've seen many dogs where these tumors are quite large. They'll ulcerate and rupture. They can require pretty big surgeries to take these off. Even though it's pretty popular right now to say that you should delay or wait for spaying your dogs, if you choose to make that decision, you need to understand there is a little bit of a balance, so risk versus reward effect, where you are increasing the incidence potentially of mammary cancer. So generally what we recommend is to allow the dog to mature, but as soon as they're matured, we will spay them to try to cut that risk down significantly. We'll get Dakota taken care of. Our plan is for her to have a long, healthy life. And as you can see, she deserves it. She's a wonderful, sweet girl. And her parents love her deeply. They just didn't understand the risks. So it's our job here to help educate them.